Clinical pathology for 7th semester medical students. Clinical pathology is a branch of medicine focused on laboratory analysis to assist in diagnosing, monitoring, and managing diseases. It encompasses various fields, such as hematology, microbiology, immunology, clinical biochemistry, and molecular pathology. In the 7th semester, students learn how to utilize laboratory data to support clinical decision-making. 1. Fundamental concepts of clinical pathology. A role of clinical pathology in medicine. 1. Diagnosis. Helps identify the cause of diseases through laboratory tests, e.g., anemia, infections, diabetes. 2. Monitoring. Tracks disease progression, e.g., cancer, or treatment effects, e.g., anticoagulant therapy. 3. Prognosis. Provides insight into disease severity or progression based on laboratory results. B. Major fields in clinical pathology. 1. Hematology. Study of blood and related disorders, e.g., anemia, leukemia. 2. Microbiology. Identification of microorganisms causing infections. 3. Clinical biochemistry. Analysis of body metabolism through tests on blood, urine, or other body fluids. 4. Clinical immunology. Examination of immune system disorders, e.g., autoimmune diseases, allergies. 5. Molecular pathology. Analysis of DNA, RNA to detect genetic mutations or viral infections. 2. Laboratory tests covered. A hematology tests. 1. Complete blood count, CBC, parameters. Hemoglobin, HB. Measures HB levels to detect anemia. Hematocrit, HT, percentage of red blood cell volume in the blood. Leukocytes, white blood cell count, increased in infections or leukemia. Platelets. Count of platelets for blood clotting function. Interpretation. Iron deficiency anemia. Low HB, low MCV, low ferritin. Leukocytosis, increased leukocytes, infections, inflammation. 2. Peripheral blood smear. Examines blood cell morphology, e.g., sickle cells in sickle cell anemia, blast cells in leukemia. 3. Coagulation tests. Prothrombin time, PT, and activated partial thromboplastin time, APTT. Evaluate coagulation pathways to detect disorders like hemophilia or disseminated intravascular coagulation, DIC. B. Microbiology tests. 1. Culture and sensitivity. Cultures from blood, urine, sputum, or other body fluids to identify pathogens. Antibiotic sensitivity testing to determine effective therapy. 2. Gram staining. identifies gram-positive or gram-negative bacteria for preliminary infection diagnosis. 3. Rapid tests, antigen or PCR tests for specific infections, e.g., malaria, dengue, TB. C. Clinical biochemistry tests. 1. Renal function tests, parameters, urea, creatinine, detect kidney dysfunction. GFR, glomerular filtration rate, measures kidney filtration function. Interpretation, high creatinine, acute or chronic kidney failure. 2. Liver function tests, parameters, SGOT, SGPT, indicators of liver damage. Bilirubin, assesses liver excretion function, e.g., jaundice. Interpretation, high SGOT, SGPT, hepatitis, alcoholic liver damage. 3. Lipid profile, parameters, total cholesterol, LDL, HDL, triglycerides. Interpretation, dyslipidemia, high LDL cholesterol as a cardiovascular risk factor. 4. Metabolic function tests, blood glucose, diagnoses diabetes, e.g., fasting glucose greater than 126 mg per deciliter. HbA1c, monitors long-term glucose control. D. Immunology tests. 1. Autoantibody tests. ANA, anti-nuclear antibody, detects autoimmune diseases like lupus. RF, rheumatoid factor, diagnoses rheumatoid arthritis. 2. Allergy tests, total or specific IgE for certain allergens. 3. Specialized immunology tests, ELISA or Western blot to detect HIV or hepatitis. E. Molecular pathology. 1. PCR, polymerase chain reaction, detects DNA, RNA of microorganisms, e.g., TB, HPV, COVID-19. 2. Next generation sequencing, NGS, detects genetic mutations for cancer or genetic diseases. 3. Clinical applications of laboratory results, infectious diseases. 1. Dengue hemorrhagic fever, DHF, low platelets, high hematocrit. 2. Bacterial infections, leukocytosis with increased neutrophils. 3. Viral infections, leukopenia with increased lymphocytes. B. Metabolic diseases. 1. Diabetes mellitus, fasting glucose greater than 126 mg per deciliter. HbA1c greater than 6.5%. 2. Dyslipidemia, high LDL cholesterol, high triglycerides. C. Autoimmune diseases. 1. Systemic lupus erythematosus, positive ANA, decreased complement C3, C4. 2. Rheumatoid arthritis, positive RF, elevated CRP, and erythrocyte sedimentation rate, ESR. D. Hematologic disorders. 1. Iron deficiency anemia. Low HB, low ferritin, low MCV. 2. Leukemia. Blast cells in peripheral blood smear, leukocytosis. 4. Student competencies in clinical pathology. By the end of the 7th semester, students are expected to 1. Understand indications for laboratory tests based on patient conditions. 2. Interpret basic laboratory results. 3. Integrate laboratory findings into patient diagnosis and management. 4. Communicate with clinical laboratories for specific test requests. 5. Practical and simulation activities, a case studies, analyzing lab results for patients with anemia. Interpreting blood culture results in septic patients. B. Case discussions, integrating hematology, biochemistry, and microbiology results in complex infection cases. C. Clinical laboratory visits. Observing procedures for blood, urine, and microbiology culture tests. Clinical pathology forms a critical foundation for evidence-based medical decision-making. Students are trained to comprehensively correlate laboratory results with patient conditions.